Everybody has skin, and almost everybody knows somebody who has had skin cancer. Skin cancer is the #1 diagnosed cancer in America. I would like to inform you of the causes, types, symptoms, and treatment of skin cancer. I would like to start by telling you what skin cancer is. Skin cancer is cancer of the body's skin tissue. Skin is an organ, and it is the body's biggest one. The skin serves several important bodily functions. For example, the skin protects the body's organs. The skin also helps to monitor the body's temperature by allowing it to sweat. Skin also is the way for the body to experience pain, as well as sensing things to touch. Skin cancer is the most commonly found cancer in America. Skin cancer alone accounts for 1/2 of cancer cases every year. There are 2 million diagnoses of skin cancer annually. The 3 major types of skin cancer are basal cell skin cancer and squamous cell skin cancer, as well as melanoma, which is the least common yet most deadly. Skin cancer can be found in any ages starting from the teenage years, but however it is most commonly in the elderly. Skin cancer is capable of forming in all races and genders. Now that you're aware of what skin cancer is, I would like to inform you of the causes and risk factors of skin cancer. The main cause of skin cancer is exposure to ultraviolet rays. This includes both UVA and UVB rays. These rays come from the sun. According to the American Academy of Dermatology, scientists now know that exposure to the sun's ultraviolet rays damages the DNA of the skin. There are, however, other ways of getting exposure to these ultraviolet rays. For example, tanning beds. Tanning beds have light bulbs that emit large amounts of UVA and UVB rays. One of the biggest risk factors in having skin cancer is being Caucasian. Although skin cancer can affect someone of any race, fair-skinned people are the most likely to get skin cancer. Those with blonde hair and light-colored eyes are far more likely to get it than those with dark skin and darker hair. There are several things known to cause skin cancer. They include repeated sun exposure, especially when the sun is at its strongest between 10 a.m. and 4 p.m. For example, those who work outside without any sun protection, people who suffered severe burns as children, are at a lot higher of a risk than those who have not experienced that. Those who have experienced radiation and people with lower immune systems have a greater risk of developing skin cancer as well. Family history is also a risk factor when it comes to skin cancer. Now that you are aware of what causes skin cancer, I would like to go into more depth about the different kinds of skin cancer. The first type of skin cancer is basal cell skin cancer, the most frequently found type of skin cancer. It accounts for roughly 80% of skin cancer cases every year. Basal cell skin cancer is skin cancer located in the epidermis of the skin. Basal cell skin cancer can appear in several different forms. One way it can appear is as a sore or a scar. Another way is red blotches covering certain areas of the skin. Another way it can appear as a growth that is slightly elevated above the rest of your skin. This type of skin cancer is small, and it also takes a very long time to spread to other parts of the body. It is very treatable, especially found early, because it very rarely spreads to the internal organs. The second type of skin cancer is squamous cell skin cancer. Squamous cell skin cancer is more rare than basal cell skin cancer. It makes up only about 16% of skin cancer cases on average. The skin cancer is found in the squamous part of the skin, which is the top layer of the epidermis. It can appear in a few different ways. For example, the skin can look crusty, scaly, red, and swollen. Squamous skin cancer can even be found in parts of the body that have never been exposed or have very rarely been exposed to the sun, such as the mouth. Squamous cell skin cancer often needs to be found early to prevent it from spreading. The final type of skin cancer I'd like to discuss is melanoma. It is the most dangerous, however, luckily it is the least common. It accounts for roughly the remaining 4% of skin cancer victims. It is usually found in moles that were there before they became cancerous. Melanoma is deemed so dangerous because of the quick rates that it spreads and its potential to spread it to the internal organs. It is crucial for melanoma to be found in its earliest stages for that reason. Now that you understand the different types of skin cancer, I would like to discuss the different symptoms that skin cancer has. The signs and symptoms of skin cancer are typically very visible. The change or appearance in the skin is a major symptom. The color and size of a pre-existing mole or a new growth or mole, unfamiliar dark spots can also be an indication of skin cancer. Bleeding, oozing, or fluids coming from an area of the skin are also found to be a symptom. An area of uneven pigmentation is also a symptom. Finally, pain, tenderness, itching, and swelling can also be associated with skin cancer. Now that I have explained the symptoms, I would like to explain the treatment for skin cancer. Different types and stages of skin cancer can require different treatments. The first step to treatment would be a diagnosis. In order to begin getting rid of skin cancer, one must be sure that they actually have it. In order to ensure this, a patient would need to have a biopsy. A biopsy can be done in several different ways. One way is to retrieve the sample through a method that involves shaving a part of the skin off. Another way is to punch out a certain area of the skin, and this may include all of the cancer or just a sample of it. To remove skin cancer, a doctor may do one of several things. They could decide to freeze the cancerous area with liquid nitrogen. They may also decide to do surgery in order to remove the cancer from the skin completely. A doctor could also use laser therapy in an attempt to remove cancer. Sometimes, however, none of these methods are considered an option. In that case, a doctor may find a need to use radiation or chemotherapy. Chemotherapy is drugs meant to destroy cancer. In skin cancer's case, chemotherapy can often include creams and lotions that are put directly on the skin. The downside to chemotherapy is the scars that it can potentially leave behind. Photodynamic therapy is also an option for skin cancer treatment. This includes a combination of laser therapy as well as chemotherapy. Another way would be biological treatment, which is to boost one's immune system with drugs. Now that I've informed you of the causes, types, symptoms, and treatments of skin cancer, I would hope that my speech has informed everyone about the various aspects of this cancer, because over 2 million people every year in America are diagnosed with skin cancer. 1 in 5 people will get skin cancer. That is why it's so important to know these causes, types, symptoms, and even treatment options.